Sinisendele ama-link amanye.
Okay.
Sure.
Okay.
Yeah, zilungile. Ngicela uMohammed usende link masinyane.
Okay, sure.
Kuzabe ilink ilento ngabe check kudala ukuthi ama-link masha noma sekuzoqalile ukuza. Umcimbi. Kwanikeza bese ba-check-a-ke ukuthi balokhuza ngoba what 4 minutes to go and then nalabanye abantu abakafiki ufethu Kanje we go ngifonela. Uthi ade ngifonele nje. Umfonele ngo-10.
Ngo-10 ya umfonele ngaleso sikhathi ke nawe uyikhona ngitshela isikhathi sishintshile. Kodwa uthe bese ngi-Christ ngaso sikhathi uIsaac
Oh.
Kufanele ukuthi usendleleni ebuyayo.
Yeah, of course. Wephile makhumana.
Right, uzohlala phi mama? La?
Either la noma lapha, depending, you can choose.
Ukhona kwi-frame? Lesihlalo sikhona kwi-frame? Lehleli lapha?
Yes.
Asikho.
So ngomthatha lapha.
Laphayana?
Oh, yeah, bangaka abantu abahleli.
By 2.
Bawu-2.
So wahlale ngale?
Yes, from my end.
Protocolically, right?
Hayi ngicabanga ukuthi i-right phela union yazi kahle lokuzani ngicathi i-right. It's always got baswapha bathi. Sengready. Hey, bulokhu zonke sikhona balokhu no the 1 or 2 ana kuthiwa ungazi ukuphi. Class, ngikhethe fika la sesikadile ashesha premier shesha manje. Hey, ngwani. Ayi mfethu yazi i-life saver ngenela ama-life saver akawazi imisebenzi. Awazi imisebenzi. Uthi uhlonishwa kanjani? Uneli yambo ngicela ucheck noneli ama-editors acela
sesikhulumile noneli
naye bengisendele message babacela ukuthi ngikhulume masinyane ngiconfirm. Okay. I guess animathole for ama questions is ngizokwazi ukuthola masinyane. And efuna ngilokhuze. Oh, ifuna mifile so angazi uzothola kanjani nyamba uzongofuata kukhaya. For send as image. As image, yeah. Okay. 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 Good day. I almost said good afternoon. We're starting a bit earlier than our usual time today. So we would like to welcome the Honorable Premier of the province of KwaZulu-Natal Premier Sihle Zikalala, as well as the Honorable MEC for Health, MEC Zikalala, and all the colleagues that are here from the media, and those that have joined us via the online platforms at home. We are here for the media update on the COVID response by KwaZulu-Natal. Without any delay, I'm going to hand over to the Honorable Premier, who is going to take us through the statement for today. Over to the Premier.
No, thanks, Mr. Mabaso, and thanks to the team, MEC Nomakuku Smelane Zulu, the officials who are here, Mr. Mabaso and all other officials, members of the media who have connected from various platforms, distinguished guests, we once again welcome you to this media briefing. Of course, we have missed you last week when we didn't have this sitting due to reasons beyond our control. Your continued commitment to bridging information and knowledge between government and communities we serve is something that we cannot and we do not take for granted. Your work is greatly appreciated. We wish to start by welcoming the announcement last night made by President Cyril Ramaphosa to move the country's risk-adjusted COVID-19 strategy from level 3 to level 2. We are pleased with the extension of the national lockdown for 30 days by the Minister of Cooperative Governance and Traditional Affairs, Dr. Nkosazana Dlamini-Zuma. As a province, we are ready for the increased economic activity. As a province, we are ready to implement all the requirements in line with the level 2 adjusted risk strategy. This transition to level 2 should, however, not make us complacent and think that the risk posed by the coronavirus is no more. This is a deadly virus. Everyone must adhere to all requirements. As the province, we will still act very tough on those who are violating the regulations. As the province that relies heavily on tourism for job creation and sustainability, our economy has contracted by at least 30 billion due to the economic lockdown. Therefore, we welcome the risk adjustment to level 2 as a gateway toward economic recovery. The opening up of the economy is indeed great news because it means more businesses will now have the opportunity to contribute in saving jobs and prevent the disaster that has befallen those who were forced to close down their operations. By the same token, we noted the joy and excitement that greeted the end of the ban on alcohol and cigarette sales. People on social media have been wrongly interpreting the lifting on the ban of smoking and alcohol as an opportunity to go back to their old habits. We wish to plead with our people not to abuse their access to alcohol and to remind them that smoking is still bad for their lungs and veins, among other dangers. We still need to ensure that our healthcare facilities are protected to prioritize saving the lives of those affected by COVID-19. We want to make it clear that the unbanning of alcohol sales is not an excuse for people to go back to drinking and driving, which result in innocent people being killed or injured in the roads. It does not give people the license to get involved in fights where others will be assaulted, stabbed, or shot. It is not an opportunity for people to get drunk and then beat up women and children. Neither does it give people the right to cross our freeways and engage in the walk in streets, because that is when they get knocked down by cars and then die. These are all the negative factors that alcohol tend to lead to, which then overwhelms our health systems unnecessarily so. In the last 7 days, the trends have shown a decline in the number of new cases reported daily since the beginning of August. We must emphasize, though, that in terms of the overall numbers, it is evidently clear that KwaZulu-Natal is still at the peak in terms of the COVID-19 pandemic. Of the 873 new cases recorded on the 15th August, eThekwini district recorded 46% and was followed by uMgungundlovu, which recorded 11%. Our observation of the decreasing number of new cases since the beginning of August is as follows. eThekwini district has been receiving a median of 697 cases daily. uMgungundlovu district has been receiving a proportion of about 181 cases daily, from 690 daily a month ago. King KZN district, which is the third largest or the third highest, has been reporting a median number of 195 cases daily, while a month ago it was reporting 266 on daily basis. While Amajuba district has been receiving a median of 117 cases daily within the same period, compared to 248 daily a month ago. With regard to top three districts, which is eThekwini, uMgungundlovu and King KZN, we want to emphasize that the whole province is still a hotspot. However, as promised, we detail here the top three districts where COVID-19 is most prevalent in the province, and that is eThekwini, Umlazi, with about 3,474 cases. The new or the active cases is 767. Phoenix, 1,439, and the active cases is 179. KwaMashu, 1,434, and the active cases of now is 274. Chatsworth, 1,138 cases, while cases that are active right now is 249. Pinetown, 956, and active cases, 159. North Dale in uMgungundlovu, 1,297, and the active cases is 27. Imbali, 1,215, and active cases is 19. Itindale, 464, and there are 9 active cases. Elandscope, 304, 6 active cases. Howick, 304, 11 cases are active. King KZN, Panorama, Grantham, and Mpangeni Central, 1,554 cases and 514 still active. Richards Bay CBD, 740, 31 is active. Umhlanga Reserve, 319 and 89 active cases. And then as Mambeni, Nasemazambaneni, 83 cases, 7 active. Mandawe, 48 and 1 active. Now, this is the top 3 of the districts, and we are detailing spots and the sub-districts that are hotspots. And it's important, though, to emphasize that they are still, all areas are still hotspots. In terms of the incident risk by district, the overall incident risk for the province was 213 cases per 100,000 population. King KZN continues to be the third with the highest infection rate of about 415 cases per 100,000. and it's followed by eThekwini district with 237 cases per 100,000. 3 districts has an incident risk of 100 cases per 100,000 population. So we detail all districts here as they are. And then in terms of distribution of cases and deaths per district between the 5th of March till now, August 15, eThekwini, the new cases that have been reported, 399. And that is 45% of the new cases in the province. But the total cases in eThekwini from March till now, it's 48,756. Deaths are 51%, and in actual numbers, deaths are 857 in eThekwini. In Ilembe, 64 new cases. The total number of cases is 5,205, and deaths are 52. Mkungundlovu, 19 new cases, but the total number of cases altogether are 13,920, and deaths are 232. In Uthukela, there are 28 new cases, but the total number of cases since March, it's 4,586 with 87 deaths. King Citwayo, 85 new cases, 8,220 is the total number of cases overall, and then the deaths are 136. Ugu, 33 new cases, while the overall number of cases is 4,280 with 80 deaths. Amajuba, 49 new cases, with the total number of cases since March being 5,935 and 86 deaths. In Umkhanyakude, 18 new cases, 2,048 is the total number of cases that have taken place since March, and 40 deaths. Hirikwala, 18 new cases, 2,081 cases that have taken place since the beginning, and 41 deaths. Zululand, 55 new cases, 4,366 total number of cases, 30 deaths. And Umzinyathi, 26 new cases, but the total number of cases that have been there since March is 2,305 with 32 deaths. Then the province have right now 873 new cases reported yesterday, and 104,619 is the total number of cases, and 1,673 new deaths that have taken place from March till now. With regard to hospital admission and isolation, on the 15th of August, the province had 1,732 patients admitted in both private and public hospitals, with 67% being in private and 33% being in public hospitals. Of those admitted, 358 patients they required intensive care services, and that is 21% of the hospitalized patients. Private hospitals had more patients in ICU, and that is 87% of all patients who are in the ICU, and 13% of the ICU patients are in public facilities. Among those who required intensive care, 58% were ventilated, Other patients, like 10%, were admitted in a high care unit in both private and public hospitals, and 91% of that was in private and 9% was in public facilities. With regard to public facilities, admission in public facilities, in terms of district, we see that we have eThekwini admitting about 240 patients, and we give details whether how many needed oxygen and how many needed ventilation. And in terms of our public facilities right now, the total number of patients that are there are 566. Inkosi Albert Luthuli had majority of patients admitted in intensive care unit, and that was 41%. Majority of ventilated patients were admitted in Inkosi Albert Luthuli Hospital, followed by Ngwelezane at 15% and King Edward at 11%. With regard to persons under investigation, the number of persons or patients admitted as PUIs continues to decrease since 8 August. However, in 4 of the 11 districts, the number of people under investigation still occupy an average of 100% of the beds prepared. Some of the admitted PUIs required ICU beds, and of those admitted in ICU, 75% were ventilated. Of the total admitted, 30% required oxygen. In terms of infection amongst the healthcare workers, a total of 3,561 healthcare workers are infected with COVID-19 since the beginning of the COVID pandemic. Above half of the infected healthcare workers are nurses. Of the total infected, only 1% succumbed to the disease, meaning only 1% passed on. Fatalities in general, KwaZulu-Natal province recorded 22 new COVID-19 related deaths on the 15th August. Of the new reported deaths, eThekwini recorded 45%, which is the highest number of deaths. Among the newly reported deaths, 18%, which in specific numbers 4, occurred in July. Those that occurred this month, they started as far as the 2nd of August. The province has a cumulative total of 1,673 deaths since the beginning of the pandemic. eThekwini Metro contribute above half of the reported deaths. The proportion age of the deaths remain 62 years. Slightly over half of the disease patients were female. Comorbidities, the most common recorded comorbidities amongst the deceased include hypertension, diabetes in a main, but there are others such as HIV and obesity. Recoveries, the overall proportion of recoveries for the province is 75%. In specific numbers, that is 78,909. We are then providing a detail of analysis in terms of the total cases and the recoveries. But provincially, the province is now standing in terms of the total cases since March till now is 104,619. and recoveries are 78,909, and that gives you 75.4 recoveries. In terms of the risk of a new and the deadly wave, we are cognizant of the threat of a new wave of COVID-19 infection coming back to overwhelm us. We've seen it in other countries where people thought the virus had subsided, and then they started behaving recklessly, making the virus to come back stronger than before. If we allow that to happen, government will not hesitate to reinstitute the ban on alcohol and bringing back a lot of other restrictions. So, once again, whether or not alcohol remain available for sale, it is entirely in our hands now. If we see more COVID-19 infections and more accidents, more shooting and violence against women and children, we will take away your alcohol, and that will not be an issue, because we must not use alcohol to abuse others or to cause accidents and shooting. Our message is therefore clear: help us to help yourself, and that is quite important. We welcome the visit by Police Minister Honorable Bheki in response to Mthwalume matters. We welcome this visit as conducted yesterday following the discovery of 2 more bodies of women in a sugarcane farm. We had noted with great concern that these discoveries happened in August, which is the Women's Month, a time when we should be celebrating and not burying women. The discovery of these bodies brought to 5 women in terms of the total number of women who have been killed under mysterious circumstances in that area since March of this year. Such killing of women and taking away the women's life is barbaric and should have no place in our society at all. We are nevertheless pleased with the Minister's investigative intervention on this case, which has led to the roping in of resources from National Head Office of Crime Intelligence and detectives, as well as the National Head of the Family and Violence, Child Protection and Sexual Offences Unit. We know that 2 people have been questioned or are being questioned about this incident, and we sincerely hope this high-level investigation will lead to arrest and conviction. As we conclude, we wish to reiterate that now it is the time for all of us to let down our guards and not behave recklessly. We should be responsible in whatever we do. Let us invest in our COVID-free future by continuing to observe the safety protocols at all times. Our collective efforts have helped us turn the corner insofar as our fight against this pandemic and others such as HIV and AIDS and injustices of apartheid before. So if we work together, we will overcome this. We can do it again with COVID-19. I thank you.
Thank you very much, Honourable Premier, for the message. I would like to take the questions. Can I get an indication of hands from the colleagues that are here first? I notice Tuba. Okay, you are first, Tuba.
Thank you so much. I will have 2 questions, one for the Premier and one for the MEC. MEC, last week when the Health Minister visited the province, you went to few districts, several districts that included Tegwini and Amajuba, And he was pleased with the measures that you have put in place, or the province that have put in place in preparing for the coming surge in the province. Are you still satisfied so far? I'm sure we only went to 2 districts, but there are more other districts in the province. Are you satisfied? And Premier, I don't know whether maybe I might have missed part of your speech, but the unbanning of alcohol, especially, I heard you saying that people should continue consuming responsibly. Are you worried that that might also cause another pose another threat in the province, especially as we are expecting the peak, or as we are in the peak in the province of KwaZulu-Natal?
Okay. Thank you very much. No one is inspired as yet. Noktula from the witnesses, she's asking about alcohol as well. She says, if liquor shops are restricted to sell alcohol between Mondays and Thursdays, does this apply to restaurants, or can you buy liquor from restaurants on Fridays and during the weekend? That's a question, I think, regulations. I think I will hand over to the Premier and the MEC to respond.
No, thanks. I think let me start with the question, the last question. I think restaurant will be allowed to sell alcohol in line with the restrictions that are placed, meaning that you sell alcohol between Monday and Thursday and nothing else. But for those who are sitting down and drinking there, I think the minister will clarify that during the course of the week, as the president indicated yesterday. We are very concerned about the use of alcohol. The results that are coming from the use of alcohol are a cause to worry. Firstly, people do not absorb alcohol in a manner that is standard. They drink and then enjoy themselves. But in most cases, you find that they abuse alcohol and then they drive. That causes accidents. They use alcohol and then they abuse women and children. And there is a clause in terms of number of reports, investigative reports and researches that have been conducted are all indicating to the link between alcohol and other social ills. And therefore, that causes a problem. In the context of COVID-19, it becomes a problem in a way that it then leads to the occupation of beds in hospital. Now that undermines the capacity to take care of the people who are infected by COVID-19. And that's why we are very, very worried. We are equally worried as a society. We cannot be classified as a society that drinks more than other countries. And I think that talks to the society that still needs to heal and that still need to embrace a kind of a level of prosperity where such social ills are not a defining feature. I think those were questions directed to me, and I will request MEC to come with her chair.
Good morning, ladies and gentlemen. Good morning to the Premier, good morning to colleagues. I think we just have one question today that we needed to respond to. And Tuba, you are correct. The minister did indicate that he was comfortable with the preparation that we had conducted in the province of KwaZulu-Natal. I must also indicate that as a province, we are also quite comfortable with the work that we have done. As you correctly point out, we only went to a couple of districts. We went to Mgungundlovu went to eThekwini and then Amajuba with the minister and just showed him some of the work in the facilities that we had conducted. However, as a province, we had actually prepared facilities in every district, and we will continue. In fact, tomorrow we have a visit that is taking us to Ugu district, where we are going to be seeing our facilities, the state of readiness of our facilities, but most importantly, the one hospital where we have converted or repurposed a number of beds, which is GJ Crooks. We did the same thing on Friday. We went to Herikwala, and we traveled to almost all our facilities with the exception of 2. And we wanted to see the extent that the work has been done. Those are not the only districts. In Zululand, we've got facilities that we have repurposed, and we have been visiting to see whether we are ready. And for lack of a better word, we actually are quite ready. In Umkanyagute, we also have facilities. Then I think Umkanyagute, we have more facilities that we have repurposed than other districts. We have done the same thing at Umzinyathi. So in essence, as a province, we have done work in almost all the districts that we have, with a couple exceptions where we couldn't really find space to be able to repurpose. Therefore, we had to put temporary structures. We've got temporary structures in 3 districts, which is eThekwini, Ilembe, and King Cetshwayo. Of course, while we have not really needed to utilize those for now because we've not had such a need for the beds, as the Premier correctly indicates, which is one of the reasons why we are calling on our people to take precautions and not take the fact that it looks like our numbers are going down and think it's now suddenly a party. Because if we don't take precautions, we are then going to find ourselves, like Premier said, with what is now termed the second wave. And the second wave will tends to be more dangerous than the first wave and have far much more dire consequences. However, should that be the case, we will continue to have our infrastructure in place. We have been told by scientists and the clinicians that until we have a vaccine, which is something that takes about 24 months, we are going to continue as a country to get infections. So the facilities that we have put in place are not facilities that are just going to be white elephants. They are going to continue to be utilized by our people because there is still going to be a need. The only difference is probably the extent to which these facilities are going to be needed. But we are quite excited by the fact that once we get a vaccine and we no longer have COVID-19 as a threat, we then are able to use the facilities that we've repurposed as part of our NHI planning as the province of KwaZulu moving forward. So it has given us an opportunity actually to revamp some of our facilities, and I think we are quite happy about that.
Is there another question from colleagues? I think they seem to be covered. We don't know whether it has something to do with the unbanning of all the other things yesterday. May we request the Honourable Premier to summarize in Zulu? It's a request from SABC.
Well, siyafisa ukuqala ukubonga. Sibonga kakhulu kwabezindaba ngomsebenzi wokuqhubeka balekelele ekufundiseni isizwe nasekudluliseni ulwazi ngalempi esibhekene nayo yokulwisana siqede lolu bhubhane lwe-COVID-19. Siyafisa ukwamukela isimemezelo sikamongameli esithi izwe lethu manje selizodlulela ku level 2 ngokwe risk adjusted strategy. Futhi siyafisa ukwamukela umbiko othi National Minister wakaKhokta umama uDr Nkosazana Dlamini Zuma uyalela ukuthi i-lockdown izoqhubeka for another 30 days siba ngaphansi ka level 2. Sikwamukela kakhulu ukudlulela ku level 2 ngoba lokho kuzonikezela ingxenye zomnotho imkhakha yomnotho yonke ukuthi be active ikwazi ukucontributor ekwakhiweni kwamathuba emisebenzi nasekukhuliseni umnotho welizwe lethu. Siyazi ukuthi KwaZulu-Natal isifundazwe esincike kakhulu ekusebenzeni kwe-tourism ukuze kwakhiwa amathuba emsebenzi. And njengamanje iprovince yakithi silahlekelwe imali ecela la ku-30 billion ngenxa ye-lockdown, and therefore ukuvuleleka kuyiwa ku-level 2 kuzosilekelela kakhulu. Sibonile abantu abakithi abaningi bethakasela ukuvulwa nokuthi sekuzodayiswa uphuzo olunamandla, utshwala nokudayiswa kagwayi. Kodwa siyafisa ukunikezela umyalelo uthi masingathi ke ngoba sekuyadayiswa mase sibona futhi kwanda imgozi emgwaqeni, and therefore sikiyeke ukuthi abantu baphuze bangene ezimotweni. But ngaphekwa lokho masiqede ukuthi abantu mabephuza bahlukumeze omama nabantwana. Masingabona abantu masebephuzile bagijime bayokweqa imigwaqo. Siyafisa ukusho ukuthi siyabonga ukuthi kubonakala ukutheleleka kwabantu kwehla kakhulu lapha KwaZulu-Natal, ngoba njengamanje inamba esinazo zithi ngosuku osuku nje la izolo ama new cases abengu 873 kanti besuka phezulu. Kodwa lokho akusho ukuthi sesi out of i-risk. Ingozi isenkulu. Sithi ke kubona bonke abantu bakithi masazi ukuthi sisekwi-peak. Igciwane lisanyuka lisabhebhetheka. Masiqinisekise ukuthi sisebenzisa indlela zokuyivikela eyifana nakho ukuwasha izandla, sisanitize, si-observe social distancing, sifake ama-mask. Indawo eyisahamba phambili ngwezinga eliphezulu iseThekwini, uMgungundlovu neKingcetshwayo. eThekwini isikakhulukazi eMlazi, ePhoenix, KwaMashu, Chatsworth and Pinetown. Kanti eMgungundlovu, Northdale, Imbali, Edendale, eLandskop noVulindlela neHowick. Kanti eKingcetshwayo iPanorama, iGrantham, Impangeni Central, iRichards Bay idolobha, indawo ebizwa ngomhlanga reserve, ezimambeni, ngonjalo nasemandawo izona indawo esirisk kakhulu. Siyafisa futhi ukusho ukuthi inamba ikhombisa ukuthi ama cases asalokho eqhubeke njalo, njengoba manje ama cases akhona ngu 104,619. Kanti siyafisa futhi ukunikezela umbiko ukuthi ama cases ahambisana nokuthi kulideleke kuthena abantu bashone. Kumanje abantu asebedlulile emhlabeni bangu 1,673. Kumele ke sizame ukuthi sizivikele kulokho. Ngingasho nje ukuthi enye into eye isiphathe kabi ukutheleleka kwabantu abayizisebenzi emtholampilo nasezibhedlela. Abantu abangu 3,561 abatholakale beabasebenzi ezibhedlela abathelelekile, uhafu wabo ngonesi. Kodwa siyabonga ukuthi iningi labo lisindile, iningi alishonanga ngenxa yalesifo. Siyafuna ke futhi ukunikezela umyalelo uthi uma abantu bezithokozisa mabazi ukuthi kusezandleni zabo, kumele sizivikele. Mangithathe leli thuba ngibonge futhi ukuthi osukwini la izolo sibone ungqongqoshe wezokuphepha komphakathi nokusebenza kwamaphoyisa ubaba uBhikicele ehambele isifunda sethu saKwaZulu-Natal, isifundazwe sethu saKwaZulu-Natal. Siyafisa ukubonga ekutheni alekelele kulesimo esibhekene naso emndaweni yasemthwalume la kutholakale khona imizimba yababili besifazane bebulewe eSimobeni, osekubeka inamba ku5 yabantu besifazane abatholakale bebulewe kusukela ngoMarch kulonyaka. Siyafisa ukubonga ukuthi ubese announce nokuthi from national kuzoba khona ukungenelela besilekelela kulokhu. Sithi nomphakathi awubambe iqhaza unikezele ngolwazi uma unalo. Ngonjalo siyathemba ukuthi laba babanjiwe ababili okuthiwa basayobuzwa baphenywe ngalokhu. Siyethemba ukuthi lokho kuzosilethela ekutheni abenzi balezi zehlakalo ezimbi kangaka babanjwe baboshwe. Siyafisa ke ukugcina ngelithi i-COVID-19 ingozi kuthina sonke, masiqhubeke sibamsane sizivikele. Siyabonga ukuthi sesikwazile ukuthi sibe kulesimo esikuso singekho worse off, kodwa akusho ukuthi sesiphumile engozini. Ngokubamsana sanqoba inkinga eziningi esikhathini esidlule. Sinqoba i-HIV and AIDS, kanti futhi sanqoba i-system eyayiyimbi yobadlululo. Ngokunjalo ke nale COVID-19 ngokubamsana sizoyinqoba. Ingakho ke sicela ukuthi bonke abantu bakithi basilekelele ngokuthi balandele imiyalelo ngokuyikho. Masingathi uma izinto zivuleleka mase thina sisebenzisa ngendlela engeyona. Nabathandi bezemidlalo mabangathi babuma bebuka imidlalo bayibuke bengamaqoqo endaweni, kepha abantu abayibukele emakhaya. Siyabonga.
Thank you very much, Honorable Premier, Honorable MEC. We adjourn here for today until next week. Thank you very much, colleagues.